Now it's my pleasure, my sincere pleasure, to welcome our next speaker, Dr. Bruce Taylor. Dr. Taylor is a senior fellow with the National Opinion Research Center at the University of Chicago. He's been working for over 20 years in applied research and evaluation and has led more than a dozen randomized experimental trials covering a variety of public safety and public health issues. And he's conducted longitudinal research and national surveys regarding intimate partner violence, sexual violence, and other related topics. As a criminologist, he's focused on identifying demographic and contextual explanations for violent and other risky behaviors. His work has been funded by the National Institute of Mental Health, the National Institute of Justice, the Centers for Disease Control and Prevention. Today, Dr. Taylor will present on his Shifting Boundaries, Teen Dating and Sexual Violence Prevention program. His other experimental research has included evaluating the effectiveness of batterer programs, sexual violence prevention for pre-adolescent girls, and, under contract with the CDC, the effectiveness of the Dating Matters Violence Prevention Middle School Initiative. I've been citing Dr. Taylor's research on shifting boundaries since I first learned of it several years ago, and I'm really, truly thrilled to hear him present at our symposium. Please join me in welcoming Dr. Bruce Taylor.
Thank you. Okay. Thank you, Elizabeth, and good morning. It's a tremendous honor to be here and to present my study findings. I just wanted to also mention, I certainly didn't do this research alone. I want to mention my key colleagues that I've worked with on this, Dr. Nan Stein from Wellesley College, and two colleagues also from NRC, where I work, Elizabeth Mumford, small world, she is a graduate here of the School of Public Health, and also my other colleague, Dr. Weiwei Liu, who did our postdoc here. So go ahead, scroll forward. All right. Okay. There we are.
Yeah, and then this also goes.
Oh, that does.
Yeah.
Oh, it's easy. Okay. Great. So first, funding disclaimer. So my views do not represent the Department of Justice, but they did fund my work, and I'm very grateful for their funding and to make all this happen. And I just want to mention sort of some of the material I'm going to cover. I got a lot to cover in a short amount of time, but I want to talk a little bit about the extent of the problem. And I'm going to use some terms somewhat interchangeably. Teen dating violence, it's sort of the more popular term that's used in the media. It's not great from a research perspective in that we're not referring to just teens. We're talking about a broader group of adolescents. And we're not talking just about violence, because some of the behavior that's abusive isn't necessarily physically violent, but it could be psychologically abusive, financially abusive, and other sorts of things. So it's not a great term, but it's a term that a lot of folks are familiar with, so we kind of stuck using it. I kind of like the term adolescent relationship abuse a little better, in that it characterizes the adolescent groups. It focuses on the fact that we're talking about relationships, which for young folks isn't always fit into the classical terms of dating. It's something that people are closely related, and I'm not going to go into this in this presentation, but there's a lot to be said about what dating is and what it isn't, but it kind of fits a little better these broader set of relationships and abuse, and that's just characterized as a broader set of things. So I'm going to talk about a little bit about the extent of the problem, a little bit about some prior research that's been done. I'm going to talk about the first study that I did back in 2005. The first trial was in the Cleveland suburbs. Then we moved the research to New York City in 2008, did trials there, and then we did a second study in New York City. Then I'm going to try to synthesize what we've kind of learned across these experiments. So first, a little something about the nature of this problem, of the seriousness of teen dating violence. So there's quite a bit of it happening. In another strand of research that I'm doing, that Elizabeth mentioned, we're doing some national surveys on adolescent relationship abuse. And what we found is that generally somewhere more than 2/3 of our youth between sort of 10 and 18 are victims of this sort of problem. And that even 62% are even admitting to perpetrating this as well. So we're pretty sure there's quite a bit of this going on. I mean, there have been some other studies that have been done. Folks might be familiar with the Youth Risk Behavioral Survey done by CDC. It's just like one sort of question, and that one shows a much lower rate. But there have been other studies that have confirmed our somewhat higher findings that we've found. Also in terms of sexual harassment, which is a part of the interventions that we do. I think when we started it was kind of a unique element that my colleague Nan Stein brought to the work. We're seeing about half of youth are victims of sexual harassment, quite a bit of that going on, and there's certainly a lot of research that documents the consequences of this behavior. So not only are people the sort of physical victims of this stuff, but there are serious consequences related to health. Mental and physical health suffers quite a bit from these kind of behaviors, more trauma symptoms, problems in school, drug use, obesity, just a whole range of problems, lots of documentation on it. I mean, one of the things that is somewhat unfortunate, just going to mention real quickly, is how we tend to silo our research. So the folks who are doing this sort of teen dating violence research, we're kind of in one camp, and then you sometimes find folks who do child abuse research in another camp. I mean, really, we're talking about a lot of the same stuff. And even when you get outside of sort of violence and look at mental health issues, that tends to be more siloed. But really, a lot of this does overlap quite a bit. So something about prior research. So going back to 2005 when we started this, there really wasn't a whole lot that had been done at that point. Folks might be familiar with Vanjie Foshi's work on safe dates. That was one of the other studies that was done with middle school youth, and she found that her intervention with school youth in rural North Carolina was successful. There's also the ongoing CDC study on dating matters. They do not have results just yet, but they are going to be coming out soon. There's also David Wolf's work on the 4th R in Canada, where he worked with 20 high schools and found treatment effects up to 2.5 years with, somewhat a different intervention than ours, but still a generally similar content. There's also Liz Miller's work, coaching boys to men with 16 high schools. She found positive results in her study. And there's also a somewhat newer study called It's Your Game, Keep It Real, where this was also an RCT done with 10 middle schools and found less teen dating violence in the treatment group. Okay. So I wanted to say a note about our work in I'm going to talk about these 3 different studies that we did, and we've got a lot to cover in a little while, so if those who wanted to hear an interesting methodological sort of description of my work, that'll have to wait for some other day perhaps, so you can read the publications we've done, because I really got to kind of go through a fair amount of material, so I'm not going to show you a lot of stats and graphs and stuff like that, although we do have those, but today I'm just going to kind of hopefully be able to describe the interventions, what we're up to, and what are some of the key findings. So in the Cleveland suburbs, we tested, at that point, really there was just Vanjie Foshi's work that had come out. She didn't get all her results out at that point, but there was at least good indication that something like this could potentially work. And we wanted to test some kind of intervention for youth on this issue. So we thought, well, let's not put all our eggs in one basket. So we came up with 2 sort of different curriculum. One was called an interaction-based curriculum. The other was a law and justice curriculum. I'll talk a little bit about how those differed. And we also wanted to work with a local rape crisis center to implement the program. We thought for sustainability all across the country, we have rape crisis centers. Those would be good places to do this intervention, although we learned that was not such an easy thing because many of the rape crisis centers have difficulties getting into schools to do these interventions, and I think in different cities they have more or less success, but where we were at this time, they really didn't have access. So one of the things we had to do was kind of negotiate for them to be able to bring them into the schools and make sure parents were okay with the idea about talking about these kind of issues. So it's a rape crisis center. So parents are thinking, my kids are 10, 11, 12 years old. Why are we talking to rape crisis center people? So we had to explain all that. And we also needed to design the intervention in a way that it was sort of feasible to implement. I mean, we could have come out with a curriculum of 20 different sessions or 30 or spent a year doing this stuff. We had a ton of material, but we couldn't. We knew we were going to just have 5 lessons. Vanjie's work initially involved many more sessions than that. I think she's got it more compressed now. But we were not going to have that luxury in the schools that we were. So we had to think about trying to get this into 5 lessons. So just a note about the interaction-based curriculum. In some ways, we were kind of thinking this was our main idea that we had, and that we were going to focus on setting and communicating boundaries. And it seems like a simple enough idea that you have this personal space, but what we found was that a lot of youth, that was kind of a foreign concept for them. They just didn't really quite get that idea. So that was the main thrust of what we had. And we wanted to focus on sort of relationships and friendships. I mean, it was about dating, but we knew that, there's a broader set of range of behaviors here, so we wanted to think more broadly about peer relationships as well. And we didn't want it to be just about violence. So one of our thoughts was that sexual harassment is sort of the public performance of these kind of acts that can lead to more dangerous things later. So we wanted to bring that into it as well. And wanted to sort of introduce this idea of boundaries that you have a right, even to people saying just verbally things to you that are offensive. We talked a little bit about sort of wanted and unwanted behaviors, and just talking about this continuum that goes from knowing someone barely to sort of having some kind of an intimate relationship. And even with middle school kids, we found, even in the Cleveland suburbs, they are in fact dating and do have intimate relationships. And we also wanted to talk about the role of as a bystander, as an intervener. Now, since we did this work, there had been whole interventions designed just around being a bystander, but we kind of started that work before a lot of that had really, I think, took hold. At least we were aware of it, but in any event, we brought that into the interaction-based curriculum. Then we had the law and justice curricula, which we thought of as being a little more fact-based. It was more about kind of talking about the seriousness of this problem and that it's something that could have implications for the police. You can get in trouble for doing these things, and kind of focused a little bit more on that, what the penalties might be for it. I mean, we did also introduce the general notion of boundaries as well there. But we wanted to have these 2 things that we would test. And then we did this with 123 classrooms in the Cleveland suburbs. It was kind of interesting that the schools initially we had thought, we'll offer this during the health class, and that would be the main place that we would do it. Turns out the schools were quite happy to have us use their science classes, which we were kind of surprised. And in some ways we had the science teachers embraced the idea. They said, "Oh, you're doing an experiment. That's interesting. I never really thought of using people in that way." I said, "Yeah, you can do experiments, people too." And as we were up there, they were kind of fascinated with that, and that kind of gave us a little bit of a link to the school. I mean, one of the things we had to certainly do was make sure this was relevant to the school curriculum, and my colleague Nan Stein had a lot of experience with that. That was more her part of the project, and really trying to link this to state school standards and other type of stuff. So we had 1,678 students, and we had 3 different school districts in the Cleveland suburbs across 7 different school buildings. So this was our experiment. We had 3 groups: the interaction-based group, the law and justice, and then a no-treatment group. So we collected student survey data from baseline, then immediately after treatment, and then 6 months treatment. We also did some focus group work with teachers. We also did key informant interviews as well with teachers and the superintendents as well. So what did we find? Okay, so the clearest finding we had was about increasing knowledge and attitudes, and that was initially, to be honest, our first intention was that we thought we could just change knowledge and attitudes, and that would be sort of the precursors for later behavioral change. That we sort of started out fairly modest, and we achieved that. And that kind of confirmed the basic sort of design of what we came up with, that we could make that kind of a change. Both groups also improved student attitudes, so we thought, again, thinking about our theory of change. I don't have time to put up our theory, but basically that's what it had. Theory of reasoned action and other types of theories went along with this. That kind of showed these as being precursors. So we were pleased that we found that. And then we also looked at violence reductions as well. And the evidence there was a little mixed, but we thought on balance it seemed that we were able to create the change we were hoping for. The treatment group led to less peer violence. The treatment led to somewhat more dating violence, which was interesting. We certainly weren't expecting that. Could have been potentially sort of a reporting issue in that we sensitize people to the issue, and then if it does happen, they're more cognizant of it and can then be a better reporter. That was one concern we had. And then we also were hoping we'd see change in sexual harassment, but we didn't. Okay, so and then more specifically, we had 2 significant results for peer violence reduction, both victimization and perpetration. And then dating violence, we had 1 negative result on dating violence perpetration seemed to increase, although victimization didn't. So again, we thought perhaps maybe we had sensitized folks who are doing this kind of behavior, say, hey, I did it, and then admit it on the survey. But in any event, we did think that because we created the knowledge and attitudinal change, which our sort of theory and program was designed to do, that this was promising. Well, at least it was promising enough that we could get another grant funded. So that brought us to New York City. And we wanted to see if this kind of intervention could work outside of sort of a suburb and bring it to a bigger city, not a whole lot bigger than New York you're going to find. And we took the work there, and we kind of based it on the work that we had already developed in the Cleveland area. We were able to get 30 public middle schools from New York City to join the project. We had 3 waves of data. One of the things that was different about this project was that we were able to not only have the classroom-based curriculum where we took the best of that, but we were also able to, so we synthesized what we thought was best from the interaction and law and justice group. We worked with the New York City's teachers, with their central office, to kind of think about what else we could do in terms of tweaking the intervention to make it appropriate for a New York City setting. I mean, we had videos and other stuff of showing, kids in grassy lawns, and so we're, in places like the Bronx and Brooklyn where they didn't have that with the schools we were in, so that we needed to be able to identify with these youth and have places and things that they would see, images like subways and stuff like that they wouldn't have in the Cleveland suburbs. So we worked with them on that. And then we also wanted to introduce a classroom, sort of doing something outside the classroom. So all the work had been focused initially on the classroom. We wanted to think, is there something we can do, environmental changes to the school buildings themselves that maybe could have some effects? The other thing was we also wanted to work with a group who could implement this long term. And there are these folks in New York City at the time, substance abuse prevention and intervention specialists, who we worked with their team to be the implementers for the project, for the intervention. Okay, so the classroom intervention, 6 to 9 weeks of curriculum material, 6 sessions. Some cases, some of the sessions, they would do like half on one day, half on another. There was some we allowed for some flexibility like that. So we weren't always able to do it in 6 weeks. And sort of similar to the Cleveland work in that, but we combined them in that we emphasized the consequences. And we thought that was a useful piece from the law and justice thing. The kids did seem to resonate with that. And to be honest, some of that, if you look at the data, I mean, the chances of being arrested for this stuff is actually pretty remote. So in some sense, we were telling them what was possible could happen, but nonetheless, it did resonate with some of the youth who could understand that piece, or at least it let them know that this was not sort of private behavior, that this is something that the law could have a say in, even if, in fact, maybe the chances of them being arrested for it are pretty remote. We also wanted to introduce the idea of law as a notion of boundaries. We talked about with them, like, think of sort of the borders of a country. That's a boundary. Think about the walls in a classroom. That's a boundary. Think about the laws as a form of boundaries that you shouldn't be crossing. And again, some of this stuff would seem pretty straightforward to us, but this was lighting up, this was sort of a light bulb lighting up in a lot of the kids when they hear this, that they didn't have this notion of being able to assert that they have boundaries, that others don't have a right to interfere with those boundaries. So we also talked about how you might communicate your boundaries in different ways. We also, just a quick idea of how we do that. We wanted to have a lot of hands-on exercises with the curriculum to get kids' attention. I mean, if we just have the the SAPIS workers just lecturing to the kids. We knew we weren't going to get anywhere. So one of the things we had is we'd have all the kids in the classroom sort of pick a partner, and one partner's on one side of the classroom, the other's on the other side of the classroom. And what you do is you'd have one stand on one side, one on the other, and then you'd ask one person to walk towards the other person, and the other person who was standing there was supposed to tell the person when to stop when they felt like that person was invading their boundaries. And then what we did was we would have the students get a big measuring tape out and measure the distance. And we would note on the whiteboard, we would note sort of boys and girl combinations, boy-boy combinations, girl-girl combinations, how much space there was. And the kids could see that there's quite a bit of variation, in people's notions of boundaries, and that they should be thinking about that, your sense of a boundary could be different than someone else. You may think your behavior is just fine, when in fact, if you think about someone else's sort of perspective, you may find that it actually sort of invades someone else's boundaries. So the school-wide intervention, we came up with something with the New York City school teachers of the notion of a respecting boundaries agreement. And this was essentially sort of like a form of a quasi order of protection. It was a notion of something that could be done in the schools. It was kind of a quitted order. It was kind of an official recognition in the school that something had happened that was wrong, and you'd get both sides of the perspective put into the boundaries agreement, and then kids would be told sort of, you need to respect this. And this was done in a way in some cases, clearly there might have been a need for a suspension in the school, and the school did that. But we worked with the New York City schools to fit this into their existing sort of discipline code and fit this in. And this was something that fit a middle ground. In fact, what we found was that at the time we developed it, really the counselors in the school, the social workers, had really no real interventions to do with kids who were having either some kind of a dispute among a partner or even close friends. They really didn't have much. And this was sort of an interim thing that we could deliver for them. The other thing we did was something called hotspots mapping. I'll show you an example of that. We also sort of based on the hotspot mapping and where the kids would tell us where sort of the problematic areas of the school were, we would then change placement of faculty and safety personnel in those places. Really actually basic stuff. Really just somewhat common sense, but really hadn't been done before. We also had posters that we brought into the project that would be brought around the school, and the posters would be sort of give a clear message that this sort of behavior is not acceptable in the school. One of the concerns we had with the classroom intervention is that some of the kids might think, well, that's something that Mrs. Jones does in her classroom. Once I'm outside of the classroom, I'll do whatever I think I need to do. And this was a message that no, this is a school-wide message that this sort of behavior is unacceptable. And then we also had this notion of school safety teams that would take the results of our surveys that we did for them about the general level of abuse and violence going on in the school, plus the mapping results, and then come up with some specific sort of approaches that they could do to help address these concerns. So just in a few examples here of the posters, and we had dozens of different kinds of posters, good-looking kids, and we'd have also, it doesn't show on these, but we'd have the name of the counselor in the school who'd be there if you need help, seek so-and-so. But, you'd have kind of good-looking kids who kids could identify with and say, wait, that happens to me, and I should do something about it. And this is just a very simple example of a student map. One of the things that was a concern when we thought we'd start out with blueprints of the school, but the schools wouldn't give us blueprints for security reasons. So we just had the kids design their own map. So what someone would do in each school is to be a sort of a school project, and they could make it as sophisticated as they wanted. But this was just a very basic one that everyone in the classroom would then use to code in red for hot spots where they sort of didn't feel safe. Green would be the places they felt okay, no problems. And yellow was kind of sort of an in-between sort of area. And this is the sort of basic design that we had, in that we had both classroom interventions. We had 7 schools that were in the upper left-hand corner who would get both the classroom and the building intervention. Then we had some who would be classroom only, the right-hand corner. And then we would have in the lower left-hand corner building only, and then you had the full control group of neither, 9 schools in that group. Okay. So we had many results across different things. I just wanted to quickly summarize them here. There were 28 different significant results we had, and most of the results were had to do with the building. In fact, we had no classroom-only significant effects. Everything involved the building. It turned out the building interventions were key to making this happen. So we'd found building and classroom work, but we didn't get the classroom by itself to work. We found reductions in any dating violence. So if you ask across the full range of physical, sexual, or psychological abuse, we found that we had reductions there. We also had treatment-reduced peer and dating partner sexual violence, and this was an important finding on the sexual violence because up to this point, there hadn't been a whole lot of interventions that have been successful at reducing sexual violence. So we were real interested to see that, and it was both for kids who were dating, but also kids who were just peers. So that was a really helpful finding, we thought, to moving the field forward. And we also found results about sexual harassment that was significant. And we found also just any peer violence we also were able to reduce that as well. So in terms of some of our other measures, we found knowledge increased for the both group, those who got the school and the classroom intervention, knowledge increased. We found that attitudes also were increased for the treatment group. We also found the treatment group was more likely to intend to avoid perpetrating violence, so that we saw more pro-social behavior. We also found changes in bystander intervening. And these results we were really happy with and led us to a third trial, which brought us to sort of New York City 2. And in this intervention, what we wanted to try to do was, one of the things we heard in doing focus groups with the youth was that so this is great for us 6th and 7th graders, but what about the 8th graders? They're still beating us up. So, well, all right. Good point. We need to start thinking about them. I mean, part of when we started this intervention was thinking about primary prevention. And it turns out that even when you start with kids 10 and 11 years old, that turns out not to be true primary intervention, and that we're finding a lot of these kids are already sort of victims. I'll talk at the very end, I'll mention that we're starting to look to how we can do some kind of intervention of this sort with elementary school students. But it is an issue. The 8th graders, we wanted to do something for them. We thought we could sort of amplify the results by including the 8th graders. So the focus of this study were these 4 groups, where we would have a 6th grade only group, we would have a 6th and 7th grade only group, we would have a 6th, 7th, and 8th grade group, and then have a 6th grade group that received the intervention over 3 different years. The first 3 groups were going to get the intervention for just 1 year. So we would look at sort of how early to intervene, look at how often to intervene, and how broadly to intervene across grade levels in order to sort of produce a safe environment. We also had a control group here, but I'm not really going to talk about those results. I'll just mention something about that too. But this is the main focus of the study. So we were basically going to compare, for now I'm just going to talk about these 3 arms that we compared. We had the sort of 6th grade only group. We had 11 schools in that group. We had the 6th and 7th grade group that had 3 schools, and we had the 6th, 7th, and 8th grade group that had 9 schools. And then for these purposes, the 6th grade longitudinal group that got 6th, 7th, and 8th over 3 different years, we combined them for these particular analyses here that I'm going to report on. Okay. So basically what we found was that the intervention was about equally effective for each of those 3 groups. Let me just step back. For the 6th grade only, the 6th and 7th grade, 6th, 7th, and 8th, across multiple measures, we found the intervention to be sort of, for the most part, equally effective and better than the control group. So that we thought was really encouraging, because part of what we had heard was that schools were looking for sort of low-cost approaches for how to intervene. And the idea of doing the intervention perhaps for all 3 grades, they might have found that a little overwhelming, but we found if you just do it for the 6th grade groups, you'll actually get benefits from it. So that was very appealing, that particular finding that we found. However, we did find that the additional saturation led to sexual harassment reductions, and that schools that delivered the 6th and 7th grade group were able to reduce sexual harassment by about twice the amount compared to doing the 6th grade only. So that was one finding that we did find, and we think we need some more sort of follow-up on that result to try to understand what we got there. But for the most part, we think, our results from this experiment in a way can kind of support sort of at least a minimalist approach, in that at least do this for the 6th graders. We've got good results. We have trial results to do this at least for the 6th graders. And that we think more research will help us trying to figure out why doing more of it doesn't seem to accentuate the findings, except for sexual harassment, where we found where we were doing more of it did help there. So a lot of results that we've got across these 3 different trials. And we hope to sort of continue this work sort of moving forward. I just want to mention a few things about this, in that there are major concerns with finding schools willing to do this intervention. So despite the trial results and effectiveness, we really can't get too many schools to do this. In fact, if you look in the country and you look at survey results done with schools about what kind of interventions they do, very few actually do interventions on this issue of teen dating violence or adolescent relationship abuse or anything remotely related to that. There are very few interventions going on in schools, despite there being multiple trials, not just ours, saying that this work can actually help. And if you look at the cost of this abuse in terms of other consequences, easily it's justifiable. I mean, I haven't done the economic analysis, but just even a rough back of the envelope sort of look at these results would suggest this makes perfect sense to do. Yet, there are a few schools through, even in New York City and Cleveland suburbs where we got the results customized for their context. I mean, there are some teachers that are continuing with it, some schools are, not all of them, not by a long shot, just a few have continued on. So even in those places, it's very difficult. And even for, a trial like this where you get funds to go out and recruit schools and you give them all kinds of incentives. I mean, for each school that participated, we were able to buy them some school laptops and some other stuff, even offering money. A lot of schools didn't want to do it anyway, despite the even earlier results we had in Cleveland. And I can't really explain why that is. Just can describe it. I mean, some people have told us one of the problems with our intervention is that it's free, which you'd think would be a plus. So we developed our project with federal funds, so we make it available for free. It's copyrighted, but people can use it for any school in the country. But people, we've been told by some folks saying that you got to make people pay for it, and then they'll value it somehow more. All right, so that's a thought there. So I would say also, in addition to sort of the usual layer of gatekeepers in trying to do this kind of study, at least for the purposes of doing these kind of clinical trials, you need a lot of schools. And there aren't really a whole lot of places in the country that have upwards of 40 or more schools. There's a handful in the country that you can go to. So that's one constraint. But there's also other constraints that we can see sort of moving this stuff forward. School district state budget cuts certainly make this stuff more difficult. I mean, we found out at the time in New York City, it wasn't just that we were being picked on for some reason. It was all mental health sort of interventions across the entire city that were being cut. So, that is an issue. Something's got to be thought about. I think there's also changing mandates as well, and I think some of the time commitments that the schools have for high-stakes testing, standardized testing, takes a lot of their time, and that's how they're judged often. But it was interesting, when we were doing this work in New York, that there definitely were people who were right on board with us and understood the importance of this work. The question is how to sort of, really amplify that. So just overall, we were able to very clearly change knowledge, change attitudes in these interventions. We were able to increase behavioral intentions to reduce violence. We got more positive bystander behavior. As I mentioned, Cleveland, we had the mixed results in terms of the behavioral reductions, but the results in terms of New York City were very clear in terms of reducing violence. So the key things to take away from this is that the building intervention alone can be effective and is a low-cost, efficient approach. I mean, really, you don't need any extra money to do the work. I mean, there's buying of posters, I suppose, but you can probably get around that somehow, and there are places that donate funds for that kind of stuff. So we think a lot of schools, this should be attractive to them. The other thing is that doing just the classroom lessons is not enough, and that there are some real cost-effective sort of ways to move forward. So I'll just put that up, and that's basically it. Thank you.